everyone, my name is Mackie. I work with Northreach Society, and I'm here today to talk to you guys about safer substance use. So before we get started, I just wanted to touch on some of the services that we at Northreach offer. So our services include trauma-informed care, harm reduction, support, referrals, community outreach, education, such as this right here, and the take-home naloxone training program, which is essentially the antidote to an opiate overdose. All of our services are also 100% free and confidential. So our mission statement is to address the social determinants of health through innovation, collaboration, education, support, and harm reduction. And our vision is a safe and inclusive world free of discrimination. Trauma-informed care is an approach in the human services field that assumes that an individual is more likely than not to have a history of trauma. The intention of trauma-informed care is not to treat the symptoms or issues related to sexual, physical, or emotional abuse or any other form of trauma, but rather to provide support services in a way that is accessible and appropriate to those who may have experienced trauma. So basically, trauma-informed care is changing the narrative from what is wrong with this person to what has happened to this person. So, dive right in. What are drugs? I'm sure everyone can think of a couple of examples, even if you're just thinking of cigarettes or alcohol or online shopping. Anything could be a drug. So any chemical that affects the human body or mind when it's consumed. Netflix could be a drug. So some examples I have here are marijuana, ecstasy, cocaine, crack cocaine, acid, heroin, fentanyl, oxycontin, Percocet, methamphetamines, crystal meth, bath salts, magic mushrooms, and ketamine. There are also so many more, and even the substances that I mentioned that aren't considered drugs usually, like Netflix, online shopping, that kind of thing. So why protect yourself? Drugs can be associated with health risks, many, such as HIV, hepatitis B and C, overdose, withdrawal, vein damage, or infection, dental and oral problems, heart disease, strokes, cancer, or lung disease. All right, so now we're going to talk about cannabis, also known as cannabinoids, marijuana, hash, pot, shatter, oil, edibles. There is hundreds of words, slang, names, everything for cannabis. It's legal now. Some of the immediate effects of cannabis can include euphoria, relaxation, slowed reaction time, distorted sensory perception, impaired balance and coordination, increased heart rate and appetite, impaired learning, memory, anxiety, panic attacks, and psychosis. And some health risks associated with the use of cannabis can include a cough, frequent respiratory infections, possible mental health decline, and addiction. Stimulants can include substances like cocaine, also known as blow, crack cocaine, which is a form of cocaine, crystal meth, also known as Tina, Adderall, study buddies, bath salts, which could be known as Cloud 9, and there are many more. So some of the immediate effects of stimulants can include increased heart rate, blood pressure, body temperature, metabolism, feelings of exhilaration, increased energy, mental alertness or tremors, reduced appetite, irritability, anxiety, panic attacks, paranoia, violent behavior, and psychosis. And some of the health risks can include weight loss, insomnia, heart complications, stroke, seizures, and or addiction. There could also be nasal damage associated, and it's specific with cocaine when snorted. Methamphetamine can cause severe dental damage, no matter the route that it is. So opiates are substances such as heroin, morphine, Tylenol 3s even that your dentist might have prescribed you, Percocet, fentanyl, and Oxycontin. Now, in a hospital setting and when taken exactly as prescribed by your physician, opiates can be perfectly safe. However, when they are abused, opiates can become dangerous. Some immediate effects of opiates can include euphoria, drowsiness, impaired coordination, dizziness, confusion, nausea, sleepiness, feelings of heaviness in the body, and slowed or stopped breathing. So some health risks associated with the use of opiates include constipation, heart problems, addiction, and fatal overdose. So the naloxone kits that we carry and that we also train people in is the antidote to this opioid overdose and the opioid crisis that we are seeing today. Club drugs are substances such as MDMA, also known as ecstasy or Molly, flunitrazepam, which is roofies or the date rape drug, and GHB, which is a liquid form of ecstasy. Some immediate effects of club drugs can include mild hallucinations, increased sense of touch, empathetic feelings, lowered inhibition, and or muscle cramps. Sleepiness, relaxed muscles, confusion, memory loss, nausea, dizziness, disorientation, and or impaired coordination. And some health risks associated with MDMA may include sleep disturbances, depression, and impaired memory, hypothermia and or addiction, unconsciousness, seizures, and coma. Dissociative drugs are substances such as ketamine or Special K, PCP, also known as angel dust, and salvia. Immediate effects of dissociative drugs may include feelings of euphoria, feelings of being separate from one's body or environment, difficulty moving, pain relief, impaired memory, delirium, psychosis, aggression, slurred speech, hallucinations, confusion, distorted visual perceptions, and some health risks associated with consuming dissociative drugs are anxiety, tremors, numbness, memory loss, nausea, difficulty or inability to breathe, dizziness, and even death. Hallucinogens are substances such as LSD or acid, mescaline, which is peyote, and psilocybin, which is also known as mushrooms. Some immediate effects of these hallucinogens are altered states of perception and feeling, hallucinations, nausea, impulsive behavior, changing emotions, paranoia, and or anxiety. And some health risks associated with hallucinogens may include increased body temperature, heart rate and blood pressure, loss of appetite, sweating, sleeplessness, numbness, dizziness, weakness, tremors, flashbacks, and or hallucinogen persisting perception disorder. There are many different ways that an individual can consume substances. Smoking is one of them. Smoking substances can have a negative impact on an individual's lung, heart, blood pressure, mouth, throat, and can also make the individual more susceptible to lung and other infections. It's important to be aware of ways to protect yourself if you smoke substances. Smoking may dry out a person's lips, so using lip balm can help keep your lips healthy. We can provide lip balm from us at Northreach. Always use a condom for oral sex. Smoking can cause gums to become damaged and susceptible to infection. And do not smoke from a plastic container. Melted plastic is toxic. Instead, use glass. Snorting is another way that substances may be consumed. Snorting or sniffing substances can cause damage to the nose, such as irritation and skin or cartilage breakdown. This irritation and breakdown on the nasal tissue can make a person more susceptible to infections such as HIV and hepatitis C. Some safer snorting practices are use your own clean straw. We cannot stress this enough. Sharing can expose you to bacteria or viruses like HIV and hepatitis C, as well as others. Lubricate your nostrils with a vitamin E essential oil. If you do not have access to a vitamin E essential oil, you can also use um, Vaseline, a chapstick, basically anything that will keep your nostrils from drying out. Space out your lines. Wait for the drugs to take effect before you have more. Change nostrils each time you snort and blow your nose between lines. This can decrease the buildup of substances inside your nostrils and can decrease the breakdown and damage done to the tissue in your nostrils. Injecting is another way that individuals can consume substances. Substances may be injected into a person's fatty tissue, muscle, or most commonly into a vein. When injected, drugs can get to the brain quickly before being broken down, and this puts the individual injecting the drug at greater risk of overdose. Risks associated with injection drug use can include infections such as abscesses, skin infections, vein infections, sepsis, or infections that can spread to other areas of the body, such as the heart. HIV or hepatitis C infections, vein scarring, increased chance of overdose, reduced blood flow to the limbs, which could result in an individual losing their limbs, vein irritation, and injecting pills can be especially dangerous due to the small leftover particles. If you do decide to inject pills, touch them as little as possible and crush them well. Mix with sterile water and filter the preparation several times. Some safer injecting practices are wash your hands and use a clean surface when preparing substances. You want to use a clean surface because you could pick up a bacterial infection from the surface that you're using. Before shooting up, clean your skin with an alcohol swab and don't touch your mouth to your dope or supplies. Use a sterile water and new Steri cup for preparation of your dope. We also provide this at Northreach. Use a filter provided with your Steri cups to draw your dope into the syringe. Don't touch the filter with your hands. Use the needle to pick it up. Don't use Q-tips, cotton balls, cigarette filters, or Kleenex. The fibers can come loose and cause cotton fever, which is not good. Always use a clean needle. It's never safe to use someone else's syringe. This helps prevent infection since the needle has not been used. It also prevents scarring and vein damage since the needle will be sharp. Don't poke the needle into the sterile water that comes with Northreach's harm reduction bags. This can cause damage to the needle. And avoid shooting up anywhere except your forearms. Other areas can be dangerous, and alternate your arms. Draw some blood into the syringe before injecting your drugs. If it's bright red, you've hit an artery and could bleed a lot. Do not inject your drugs. Remove your needle and apply pressure for 15 minutes. If bleeding hasn't stopped by then, get help. If using a small vein to inject, go slow so that you don't damage the vein. Always aim the contents of the syringe upwards. Throw away everything you've used to prepare and inject the drug after one use. Use a sharps container to dispose the needles safely. We can also provide these sharps containers from Northreach. We have a variety of sizes. So, protecting against an overdose. Some ways that you can protect yourself against overdose is know your dealer and know what you're taking. Start slowly if you haven't taken drugs in a while, especially after being in jail or a detox facility. Have naloxone training and have a kit. You can get this from Northreach. Don't use alone. Try to have a sober friend around to help. And use a clean equipment. Drug residue can stay left over on the syringe from the last use and can cause an overdose. So, some differences between a stimulant and a depressant overdose. A stimulant overdose, you would experience chest pain, disorientation or confusion, severe headache, seizures, high temperatures, overheating and sweating, difficulty breathing, agitation and paranoia, hallucinations, and possibly unconsciousness. As far as a depressant overdose, you would experience shallow breathing or not breathing at all, snoring or gurgling sounds, blue lips or fingertips, floppy arms and legs, no response to stimulus, disorientation, unarousable, meaning they can't be woken up, and unconscious. Some things to keep in mind. If you're planning on using drugs, use new equipment every single time. We can help provide that for you. Pay your bills before you use. That way you won't go over budget and it can help to reduce your stress. Some people may find that when they use, they do things that they normally wouldn't. So set boundaries for yourself and always carry safe sex supplies like condoms. And remember to rest and take care of yourself. Thanks for listening to my presentation on substance use. If you have any questions, please feel free to email me at education.fm@northreach.ca. Thanks. Have a great day, guys.